Hi, this is Dr. Anil Kumar, Pediatric cardiac surgeon at KIMS Hospitals, Hyderabad. I have with me a family sitting with us. They are from Somalia, and the baby is about 7 months old, weighing about 7 kilograms. The baby came to us with a heart problem called the cyanotic congenital heart disease, and it's one of the usual problems we see in children with heart problems. That's called Tetralogy of fallot. As we all know, Tetralogy of fallot is a combination of problems in the heart, but the two major things in tetralogy is a hole in the heart called the VSD. This VSD is a big hole in the heart between the two lower chambers. In addition, the hole is not the important part in this operation. The main problem for the baby's heart is from the right ventricle, the blood going to the lungs from a tube called pulmonary artery. The entire tract is small. That is the right ventricle outflow tract, which includes the pulmonary artery and the pulmonary valve, which it is small in the entire length. There is a muscle obstruction causing reduction of blood flow to the lungs, and the pulmonary valve, the valve which guards the blood flow to the lungs, is small, and the pulmonary artery itself is small. So in essence, the blood flow to the lungs is diminished, and the baby becomes blue, and the baby doesn't gain weight. So this baby came to us with this problem, and for this baby, we did complete repair of the heart. Repair in the sense we closed the hole, and then we reconstructed the entire track, which the pathway of the track from the right ventricle to the which takes blood to the lungs. This reconstruction includes enlargement of the pulmonary artery, and then cutting off and dissecting all the muscle bands which are causing obstruction to the blood flow. But the main problem is the pulmonary valve. So in usually during repair of the Tetralogy of fallot, we try to preserve the baby's own valve. If the valve leaflets are good and supple and thin. But in this baby's, the problem was the valve is not very good. It is slightly thickened, and it is which is called moderate dysplasia. So in this problem of the valve is associated with the small size of the tract that is called annulus. So in this situation, when we do the repair or reconstruction of the right ventricle outflow tract, we have to cut the annulus completely and enlarge it quite big, to make it big. So when we make it big, the baby's valve is small, and it can't compensate for the entire outflow tract. So what we do, we use a thin membrane, synthetic material called the polytetrafluoroethylene. It's called PTFE membrane, which is very thin. And using this membrane, we reconstruct we make a new valve. One part of the valve is completely with this membrane, and this membrane part of the valve opposes with the baby's own tissue valve, which is little small, and this completes the repair of the right ventricular outflow tract. So by doing this valve reconstruction, the heart will not have any leak into the right ventricle. So this is supposed to give a good long-term outcome. And in our experience, we have found this reconstruction using this PTFE valve with excellent early outcomes. And when the baby grows, the valve which we reconstruct will compensate for quite a amount of the right ventricular outflow tract. And this, as I said, the baby's own valve, which is smallish, will grow in future because we repaired the valve. We made it thin, and it was slightly thick. We made it thin, and when we repaired the leaflets, so when they function and when they grow, in future they will they are working in conjunction with the valve reconstruction which we did with the artificial membrane. So hopefully there should not be any leak when the baby's own valve tissue grows in future. So this is supposed to give a good outcome for repair of Tetralogy of fallot. Thank you.
Bismillah. First, I would like to start the Islamic greeting. Assalamu alaikum. After that, I would like to talk about the condition of this baby patient. And really, this baby patient, firstly, and I wanted to tell my name, and I'm Abdisamad Nur Mohamed, the uncle of the baby. And this baby was suffering an heart problem and breathing problem from his birth, and he has been hospitalized in so many times in Somalia, in our country. Then there was no improvement. Then the baby's family has decided to go abroad for further medical treatment. So I was in Hyderabad at that time. The family has contacted me, and then I tell them to come in Hyderabad. They have arrived in March. Then we have come to Dr. Anil to see and evaluate and treat the patient's condition. And before, around 2 years ago, and also another patient with a heart problem with the same family, Dr. Anil has been operated and has been succeeded that operation. So according to that experience, we come to Dr. Anil to treat this baby patient also. He has been diagnostic and some tests. Then he told us to stay some more time and to wait to increase baby's weight and baby's age to avoid the risk of the surgery. After that, we have been waiting for around 3 months, and he has been given some treatment, some medications for the baby. Then, and after some time, he has again checked the baby, and he has decided to operate the baby. He has fixed the appointment of the surgery date. Then, the surgery was done, and the doctor has successfully operated the baby. Before the operation, baby can't feed well. His skin was blue, and he can't feed well, and he has a respiration problem. After the operation, now he can feed well, and he can breathe well. Everything is okay. Now you see he is playing well, and we are really like to thank you and appreciate Dr. Anil for his best surgery, and we have good experience for his treatment. We are also here thanking for Mr. Gautam, the secretary of Dr. Anil, and I'm also appreciating all the hospital staff and especially International Patient Service. Thank you of all of you.
Bismillahirrahmanirrahim. Assalamu alaikum wa rahmatullahi wa barakatuh. Anigoo Sacdi Xasan Mataan dhalay macnaha wiilka yar oo Abdisamad hooyadiis anigoo waxaan ka imid dalka Soomaaliya gaar ahaan Muqdisho. Waxaan imid Hyderabad. waxaan joogaa Hyderabad maxay toole ilmaha yar markaan keenay wuxuu jiray 3 bilood iyo 10 habeen wuu iga xanuunsanayay waliba aad ayuu xanuunsanayay waxaan u keenay Dr. Anil Kumar waxaan keenay isbitaalka Kimis waxaan u keenay Dr. Anil Kumar ayaan u keenay asagoo xanuunsanay marka xoogaa waxna ma cabi jirin neefsashadiisa way dhibaysay markuu seexanay xitaa si aad u seexan jirin waxa moodaa markuu seexanay xitaa indhiis inay rogan yihiin aad moodi inuu ku soo fiirinayo marka alxamdulillah tiktoorkii ayaa la kulanay si fiican ayuu noo qaabilay xaaladiisa marka sii dambeysoo noo daaweynayay xaaladiisa isaga ayaa la socday ma sha Allah markasta aan is iraado alla cunugaaga aan ka murgoonayo kale markaan u imaado aad iyo aad ayuu ii qancin jiray anigoo qanacsan oo faraxsan ayaan isbitaalka ka bixi jiray ma sha Allah wiilkayga hadeertaan waa lagu guuleystay qaliinkiisa alxamdulillah rabbil caalamiin hadeertaan waxaan ku rajiifkiisa u seexdaa caaniis oo cabaya neefsashadiisa si caadi ayuu u neefsanayaa aad iyo aad ayaan ugu faraxsanahay murugtii iheedan ku iri maalinkii lagu guuleystay ay saa iiga baxday marna qor igu may harin marka alxamdulillah ma hadas ilaahay baa iska leh aad iyo aad ayaan ugu mahadcelinay Dr. Anil Kumar uu mahadsan yahay wiliga inta noola waa sheegi doonaa hada meel kasta tago waan sheegaa marna waxaan ku iri amaantiisa aad ayaan u amaani doonaa marka alxamdulillah waad arkaysaan wiilkayga inuu fadhiyo hadlaayo maasha allah marka alxamdulilah doctor Anil Kumar wuu mahadsan yahay boqolkiiba boqol aad ayuu u mahadsan yahay alxamdulilah rabbil caalamiin marka hadeertaan marka waa kaas hadda caanihiisa wuu cabaaya jiifkiisana wuu fiican yahay wax dhibaataa ma jiraan arintiisana waa la xaliyay doctor Anil Kumar ayaa xaliyay ku guuleystay wax barbaleena hadda ma jiraan aad ayuu igu fiican yahay marka alxamdulilah ilaah baa mahad iskale anigana waan faraxsanahay boqolkiiba boqol aad ayaan u faraxsanahay sidaan mooday sidee maanta noqotay kaafi kala dheeri waa marka alxamdulilah boqolkiiba boqol waa mahadsan yahay doctor Anil Kumar aad ayuu u mahadsan yahay good عليكم السلام ورحمة الله وبركاته